Good morning, students. Today we will start with a new chapter, that is management of trauma. Okay. So first is the definition. What is a trauma? Trauma refers to an injury, a damage due to an external violence producing injury or degeneration. So an injury or a damage due to an external violence is referred to as trauma. Now, what are the causes of dental trauma? It could be falls and collisions, sports activities, domestic violence, automobile accidents, assaults, patients with cerebral palsy, epilepsy, etc., because there is a chance of them falling down frequently. Last is child abuse. So these are the possible reasons a patient can have trauma to the dentition. Next, prevalence of traumatic injuries. When we consider the age, 1 to 2 years of age is most common in primary dentition. This age is when the child learns to toddle and is relatively uncoordinated. At around 1 to 2 years of age, the child just learns to walk. So there is a chance that he might fall down frequently. So for the primary dentition, the most common age group is around 1 to 2 years. Then comes 8 to 11 years of age in school going children shows a high prevalence of trauma for permanent dentition. Okay, by the age of 8 to 11 years, the child has started going to school and he is involved in various outdoor activities. Okay, so at this age, more chances of falling down is there, and that is the permanent dentition is affected. So for the primary dentition, the most common age group is 1 to 2 years, and for the permanent dentition, it is around 8 to 11 years. Now, when we consider the gender, boys are more prone to traumatic injuries when compared to girls. That is, the reason is because boys are involved more in physical activity. They are involved in they are involved in the outdoor games like football or cricket, or they are physically more active than girls. So traumatic injuries are more common in boys than girls. The ratio is 1.5:1. Now, primary dentition shows no sex predilection. Now, when we see the teeth involved, 37% of the cases, the teeth involved will be upper central incisor. In 18% it will be lower central incisor. In 6% it is lower lateral incisor, and in 3% it is upper lateral incisors. Facial injuries are common in boys of 6 to 12 years of age. Frequent injury in primary teeth is luxation. Mandible is mostly affected. In permanent teeth, it is uncomplicated crown fracture. These are just facts. Okay, when we consider the prevalence, these are just a few facts regarding trauma. Now, what are the predisposing factors for trauma? Malocclusion, which predispose to dental trauma, are increased overjet with protrusion of upper incisors and insufficient lip closure, angles class 2 division 1, angles class 1 type 2, epileptic patients, dentinogenesis imperfecta. So, for the patients, in short, we can say those patients who have proclined teeth, that is increased overjet with protrusion of upper incisors and insufficient lip closure. In short, we can say patients with proclination. Those patients are highly prone to dental injuries. Then epileptic patients, because of the chances of frequent falling down. Then comes dentinogenesis imperfecta. In dentinogenesis, what happens is the tooth is very much fragile. They are not strong enough to withstand even the slightest of the trauma. So chances of fracture is more in dentinogenesis imperfecta. Then comes mechanism of dental injuries. Dental injuries can occur either because of direct trauma or because of indirect trauma. Direct trauma means when the tooth itself gets stuck by some object. For example, the tooth hitting against a table or tooth hitting against a cricket bat. Those all comes under direct trauma. Then we have something known as the indirect trauma. That means the lower arch is forcefully closed against the upper arch. That is a blow to the chin. When the person gets a blow to the chin, what happens is the chin forcefully closes against the upper arch. Then the upper dentition gets an indirect trauma. That is, usually the molars are affected by indirect trauma. Okay, when the person falls down by hitting the chin suddenly closes against the upper teeth, and then the upper teeth gets fractured. So this comes under direct trauma. So we have two types of trauma, direct and indirect trauma. The extent of trauma can be assessed by 4 factors. Energy of impact, that is, we know mass into velocity. Resilience of the impacting object, hard, whether the impacting object is hard or soft. Depending upon the hardness and the softness, the extent of trauma varies. Shape of the impacting object, whether the object is a sharp or a blunt one. If it is a sharp one, we will get cuts. If it is a blunt one, we will get contusions. You know what is a contusion? Contusion means what we call as chadava. Okay. So if it is a sharp object, we get cuts. If it is a blunt object, we get contusions. Next is direction of impacting force. So the extent of trauma can be assessed by 4 factors: energy of impact, resilience of the impacting object, shape of the impacting object, and direction of the impacting force. Now, coming to the, so it was the introductory part. Now moving on to the what we have to actually study, that is classification of trauma. We have 2 classifications, Ellis and Davey classification and classification by Andreasen. Okay, you have to study both these classifications. From exam point of view and from clinical point of view, Ellis and Davey classification is more important. So, Ellis and Davey classified fracture. They put forward this classification in the year 1960. They have classified fracture into 9 types. According to them, there are 9 types of fractures. So first is the class 1. Class 1 means simple fracture of the crown involving little or no dentin. That means class 1 is fracture involving only the enamel. Class 2 is extensive fracture of the crown involving considerable dentin but not the dental pulp. That is fracture involving only the dentin, not extended into the pulp. Class 3, extensive fracture of the crown involving considerable dentin and exposing the dental pulp. So first 3 classification നമുക്കറിയാം, അത് സീരീസ് ആയിട്ട് അങ്ങ് ഓർത്ത് വെച്ചാൽ മതി. Class 1 is involving only the enamel, Class 2 is involving enamel and dentin, Class 3 is involving enamel, dentin and pulp. Moving on to Class 4, traumatized tooth which becomes non-vital with or without loss of crown structure. See the picture? We have 1-1, see the color change in 1-1. That color change indicates that the tooth is non-vital. So if such a patient comes to you, then you can classify it as class 4 dental fracture, traumatized tooth which becomes non-vital with or without loss of crown structure. Class 5 is loss of tooth, that is complete loss of tooth, we call it as avulsion. Class 5 is complete loss of tooth or avulsion. Class 6 is root fracture with or without loss of crown structure. See the picture? Class 6 is root fracture with or without loss of crown structure. So 6 nu parna root fracture. 7 is displacement of a tooth without fracture of the crown or root. So in class 7 there is no fracture. neither the root nor the crown is fractured. What happens here? What has happened here? There is only displacement of the tooth. This displacement can occur in any direction. See the first picture. In that picture, displacement has occurred in the palatal direction. In the second picture also, the displacement has occurred slightly in the palatal direction and also in the downward direction. In the first picture also it is downward. So that means extrusion of the tooth has happened, whereas in the third picture the tooth has gone inside into the socket. That means an intrusion has happened. So displacement can occur in any direction, either palatal or buccal or upward or downward, intrusion, extrusion, whichever way the tooth has moved, but there is no fracture to the crown or the root. That is classified under class 7. Next is class 8, that means fracture of crown and mass. A crown as such has fractured and it has disappeared. That means the root is there still inside the socket, but the crown has broken down as en masse. That is fracture class 8. Next, last one is class 9, that is traumatic injuries of deciduous teeth. Any kind of trauma occurring to the deciduous teeth is classified under class 9. Okay. So Ellis and Devi has classified fracture of anterior teeth into 9 classes. Class 1 is fracture involving only the enamel. Class 2 is enamel and dentin. Class 3 is enamel, dentin and pulp. Class 4 is non-vital tooth. Class 5 is total loss of tooth or avulsion. Class 6 is root fracture, 7 is displacement, 8 is fracture of crown and mass, and 9 is any kind of fracture that occurs to the deciduous teeth. Moving on to the next classification by Andreasen. It was the classification that was adapted by WHO. They put forward the classification in the year 1981. The following classification includes injuries to the teeth, supporting structures, gingiva and oral mucous membrane based on anatomical, therapeutic and prognostic consideration. See, in Ellis and Devi classification, we are classifying based on only the teeth. A pallin endu sambhavichu ennulla peril maatramaanu nammal Ellis and Devi classify cheythathu. But in Andreasen's classification, we are classifying it according to injuries of the teeth, supporting structures, gingiva and oral mucous membrane, and it is also based on anatomical, therapeutic and prognostic consideration of the tooth. This classification is applied to both primary and permanent teeth. So, they have classified it under 4 headings, that is injuries to hard dental tissues and pulp, injuries to periodontal tissue, injury to supporting bone, injury to gingiva and soft mucosa. First we will see injury to hard dental tissues and pulp, that means injury to the teeth. First is crown infarction, an incomplete fracture of the enamel without loss of tooth substance, just a crack line. Okay. So, it is just an infarction or a crack line on the tooth, on the crown of the tooth, an incomplete fracture of the enamel without loss of tooth substance. Uncomplicated crown fracture, that means fracture involving enamel or dentin but not exposing the pulp, that is uncomplicated. Next comes complicated crown fracture, that means involving enamel, dentin and exposing the pulp. Next category is uncomplicated crown root fracture, that means both crown and the root are fractured but it is uncomplicated, that means it is not involving the pulp. Then what all are involved? Enamel, dentin, cementum but not the pulp. Next is complicated crown root fracture, in that enamel, dentin, cementum along with that pulp is also exposed. Then comes root fracture, fracture involving dentin, cementum and pulp. So, these are the different subheadings that comes under injury to the hard tissues. Next is injuries to the periodontal tissues. Concussion. Any injury to the tooth supporting structures without abnormal loosening or displacement of the tooth but with marked reaction to percussion. Concussion എന്ന് വെച്ചാൽ ടൂത്തിന് ഫ്രാക്ചർ സംഭവിച്ചിട്ടില്ല, ടൂത്ത് ഡിസ്പ്ലേസ്ഡ് ആയിട്ടില്ല, ബട്ട് the tooth shows marked reaction to percussion. നമ്മൾ ചതവ് എന്നൊക്കെ പറയില്ലേ, കൺട്യൂഷൻ ചതവ് എന്ന് പറയുന്ന ആ സെയിം കൺസെപ്റ്റ് തന്നെയാണ് പല്ലിൻ്റെ കാര്യത്തിൽ നമ്മൾ കൺകഷൻ എന്ന് പറയുന്നത്. പെരിഡോണ്ടൽ ലിഗമെൻറ്റിന് ഒരു ചതവ് സംഭവിച്ചിട്ടുണ്ട്, ബട്ട് ടൂത്ത് ഇസ് നോട്ട് ഫ്രാക്ചർഡ്, ടൂത്ത് ഇസ് നോട്ട് ഡിസ്പ്ലേസ്ഡ്. So concussion is any injury to the supporting structures without abnormal loosening or displacement of the tooth but with marked reaction to percussion. Now subluxation means injury with abnormal loosening but without displacement of the tooth. In subluxation, what has happened, the tooth has loosened in the socket but displacement has not occurred. Then we have intrusive luxation, that means the tooth has gone into the socket, displacement of the tooth into the alveolar bone. This injury is accompanied by comminution or fracture of the alveolar socket. Then we have extrusive luxation, also known as peripheral dislocation or partial avulsion. Partial displacement of the tooth out of the socket, only partial displacement. Okay. Then we have lateral luxation, that means displacement of the tooth in direction other than axially. This is accompanied by comminution or fracture of the alveolar socket. Lateral luxation means in any direction, palatal, buccal, in whichever direction other than the long axis of the tooth. Then comes exarticulation or complete avulsion, that means complete displacement of the tooth out of the socket. Injuries of the supporting bone. Comminution of the alveolar socket, crushing and compression of the alveolar socket. This condition is found together with intrusive and lateral luxation. Fracture of alveolar socket wall, a fracture contained to the facial and the lingual socket wall. Fracture of the alveolar process, which may or may not involve alveolar socket. Fracture of mandible and maxilla, a fracture involving the base of the mandible or maxilla and may not involve the alveolar socket. So these are the classifications according to injury to the supporting bone. Then comes injury to the gingiva and oral mucosa. Laceration, a shallow or deep wound in the mucosa resulting from a tear and usually produced by a sharp object. Laceration, or proper cut. Contusion, as I said earlier, a bruise usually produced by impact from a blunt object and not accompanied by a break of continuity in the mucosa causing submucosal hemorrhage. നമ്മൾ പറയുന്ന പോലെ അതൊരു ചതവാണ്. There is no it is not accompanied by break in the continuity of mucosa and there is submucosal hemorrhage. Last is abrasion. Abrasion of the gingiva or oral mucosa, a superficial wound produced by rubbing or scraping of the mucosa leaving a raw bleeding surface. അതായത് നമ്മൾ ഒരഞ്ഞു പോവുക എന്ന് പറയില്ലേ, that is abrasion. Okay, so these are the different types of injuries according to the gingiva or oral mucosa.